Thank you, Madam Chairman. I welcome our guest. Tony, I hope you're having a mild case. To our witnesses, thank you for coming back to the Health Committee. When we were last together in January, our country was in the throes of the original Omicron surge. At that time, I asked you one basic question: what's the plan? I hope in your opening statements, or maybe when I ask this question in the question round, somebody will give me an answer. The chairman just did a fabulous job of painting Republicans as an obstacle for there not being enough emergency funding. I remind my colleagues, we spent $1.9 billion just on COVID a year ago. Where's that money gone? How's it been spent? Where is it obligated? No plan's been presented, but on multiple occasions, the chairman's been in the room when I've said, here's a condition, present us a plan. Now, in early May, this plan went out. It just tells me what you would buy if you got $10 billion and what you would buy if you got $17.5 billion, and it says confidential. This isn't a plan. When is somebody going to share with the American people the destination we're trying to get to and how we're going to get to that destination? We're still in crisis management, and we're 2.5 years into this. And I'm really sympathetic of Dr. Fauci's position because Tony, more than anybody, understands we're dealing with a virus that continues to evolve and change. But since the time we last got together, we've seen Omicron subvariants take hold. Right now, cases of BA4 and BA5 are creeping up around the country. In January, I asked you yet again how this administration was looking to other countries that have already experienced new surges so that we can prepare for the impacts of new variants in the U.S. and inform our response. BA4 and BA5, for example, caused a new wave of infections in countries where they're dominant, like South Africa and Portugal. 22% of the cases in the United States are currently BA4 or BA5, a number that continues to increase daily. We're learning from other countries and regions that are ahead of us, like Israel and Europe. What do we need to be doing today to ensure that we're prepared for what we face in the weeks and the months to come? I've asked you repeatedly about studies out of Israel and other countries. I've been frustrated by the lack of detail about what you're learning from other countries and how it informs our COVID response. So quite frankly, I sent my staff to Israel over the Memorial Day recess. It's my understanding that we meet regularly either by phone or in person with our Israeli counterparts. During these meetings, they share the latest COVID trends in Israel and any updated data on their vaccine clinical trials and studies. If you're getting the information regularly, why is it taking so long for us to act on it? In January, Israel became the first country to offer a fourth vaccine dose to individuals over 60 and healthcare workers that were at least 4 months past their first dose, or their third dose. Israeli health ministers announced new data at the end of January demonstrating additional protections from a fourth vaccine dose for those 60 and over. It took CDC 3 months to take similar steps. I'll say it again, 3 months. Israel has also taken steps to appropriately target the use of limited COVID-19 countermeasures. Israel targeted its supply of oral antivirals to treat those with the greatest risk of severe illness to keep them out of the hospital and to keep them alive. Meanwhile, the Biden administration developed a new plan, Test and Treat, strategy to provide therapeutics to anybody who presented and infected and came up positive. The terms of the emergency use authorization are that Pfizer drugs should be given to high-risk patients, not everyone who tests positive. There's the Israeli data influence. But the way we've applied the EUA instructions from FDA is hand it out to anybody who walks in and tests positive. Test positive, get an antiviral. The terms of the emergency use authorization, I said, but I'll quote this. People can, this was the president, people can get tested at a pharmacy and if they're positive, receive antiviral pills on the spot at no cost. So either the president was confused about his own announcement or you're deliberately giving these pills to too many patients, violating the terms of the EUA, putting people at risk and wasting treatments and taxpayer dollars. I'm puzzled by the wide gap in our approaches when so much data is regularly being shared between health leaders in both countries. Before you say our countries are different sizes, I'll remind you that we can approve drugs and devices based on samples of just a few thousand patients. The virus is the same in Israel and in the United States, and we've seen Israel get hit by new variants between 6 and 8 weeks before the United States. Israel's quick and decisive actions in early December delayed the onset of Omicron wave by 5 weeks. They had a clear path and clear leadership. Meanwhile, we've discarded over 82 million COVID vaccine doses in the United States, and this administration assumes that at least 50% of booster doses we purchase this fall will go to waste. My God, folks, let's figure out a different plan for inoculating these people. Why do we keep falling further behind? Why aren't we trying to do better? Why aren't we learning from our mistakes? Doesn't seem like we're striving for anything other than mediocrity. Have we given up? Let me highlight just a few of the more glaring inconsistencies. In April, CDC released data indicating nearly 60% of the Americans and about 75% of American people and 75% of children had at least one COVID-19 infection by the end of February. Though more recent data has not been released, I imagine the infection rate is even higher today, given the recent spikes in cases. We know the majority of Americans age 5 and over are vaccinated. So the majority of Americans have some degree of protection against the virus, yet we only removed our pre-departure testing requirements for travelers entering the United States legally this past Sunday. Many EU countries lifted their pre-entry testing requirements for fully vaccinated travelers in February and March. Canada followed suit in April. This is not an isolated example of where we lag behind because we either don't believe the data that they're providing or it doesn't fit with the narrative that we're trying to carry out. In response to a letter I wrote about my concerns with CDC termination of Title 42 order, you wrote, quote, "The COVID-19 risk for U.S. communities is greatly reduced for most people compared to earlier in the pandemic," end quote. So why are we still in an urgent state of emergency and taking months to remove restrictions that other countries have been removing since February? American people are fed up with confusing messaging and inconsistent response. So let me ask again, what's the plan? More than 2 years ago, 2 years into this pandemic, the American people are going back to work in person, attending weddings, events, traveling for work and leisure, and government still allows its employees, even at the FDA, CDC, and within a HHS platform, to work remotely. Individuals who are at higher risk of severe illness are those who live in communities with higher levels of circulating virus know the precautions they need to take to keep themselves and their family safe. And if they get sick, we have tests and treatments to help them recover. We know more now than we did 2 years ago. We have more tools today to save more lives. Do we know everything? No. It's past time to think about the future. I've asked you over and over again for a plan. The plan for gaining back the trust of the American people and moving our country forward. 6 months later, I still haven't received an adequate response to what the plan actually is. Since I'm having trouble getting a response to my initial question, let me end with asking each of you a slightly different one. Every good plan is crafted around an intended outcome. So I hope all of you can answer this. What's your end game? Maybe I'll respond differently to the chairman about the attacks that we're standing, Republicans, in the way of funding emergency money. But CDC says it's not an emergency anymore. That's why they're in Title 42. I can go through a litany of things that suggest this has transformed to somewhere. We're in a period that there needs to be an accountability for how we spent the $1.9 trillion devoted to COVID. I think any country in the world laughs at the way we're spending our money relative to this crisis and this virus. So I'll continue to ask you for a plan until we get one, and I'll continue to be a roadblock for those who believe that we can blindly just appropriate emergency money, borrow it from the Chinese, and spend it on something that none of us have a clue as to what the plan is. I thank the chair. I yield back.